And it's how do you say your full name?
Yeah,
Sharon.
Sharon Casargalia,
Okay, so it's not as bad as I thought.
as you thought. How did you think the
I don't know.
pronunciation?
I think I was like seeing Caesar somewhere
Oh,
in
yeah,
there.
yeah, yeah, absolutely. So when I was in primary school, they used to call up Sharon Caesar, like in assembly or something. Or when I was
Yeah,
being roll call or bus call or something, they'll be like, Sharon Caesar, are you here?
yeah,
Yeah,
yeah. I think like if you look at it like quick enough, like it's like your brain goes that way. So okay, good.
yeah,
Yeah, for when I record the intro and everything, then I'll know.
yeah.
But okay. Okay, are we ready?
Oh,
Here
good.
we go. Let me see, record. Let me move this over. Okay.
Recording in progress.
Hello and welcome. Welcome back to the show and welcome to Sharon. We're doing this. We're making this work, right?
Yes, absolutely.
Sharon's in Australia, but I think she has so much to offer to the audience and a different perspective, and I can't wait to dive in. So let's start by just telling us about you. You know, you've been in this for like 20 years,
Yeah,
right? Like
yeah,
for quite some time.
yeah.
So yeah, so tell us, how you got started with everything that you do, what you do, and kind of who you work with.
Absolutely. Firstly, Lindsay, thank you for having me on your show. I've been so excited for this for a few weeks now. So yeah, you're right. I've been in this space for 2 decades, working with women and men, but working mainly with women in a functional space I probably didn't realize 20 years ago. And I started in clinical practice, so nursing science background, and working clinically, in health promotion, in treating with extracorporeal shockwave therapy, so injuries, and working in that setting, working with women to get their PAP screens, working with kids to work with them for sexually transmitted infections, working with Indigenous groups. So I've done a lot of that in that health promotion slash, clinical science setting. And then landed a job with Diabetes Victoria as a nurse holistic health coach. And it fit in well with me because having babies and everything else, I could start to do some things in my own space. And I've been with them for 17 years. And that role really broadened out because we started introducing, unfortunately, with the prevalence of type 2 diabetes predisposition here, was working with a lot younger people. We're working with women who had polycystic ovarian syndrome, PCOS, or now with the name change, and working alongside a lot of a broader category. That sort of spanned me out. And so at the same time, I ran my own business called the Holistic Health and Wellness Coach. So I did that as an addition to what I'm doing now because I knew that there were some gaps there. So whoever couldn't get into the diabetes program, who were pre-diabetic and ended up with type 2 diabetes and gestational diabetes and other metabolic issues, were falling through the gaps. So I wanted to provide that space. So then I opened my own business for that and worked as a metabolic, in that metabolic sort of transition and metabolic practice, but also hormonal work. So doing that, sort of then spanned me out into perimenopause and menopause as it does, and endometriosis and PCOS. And as I was working, I was studying more and I picked up on a few, I was studying functional nutrition. I was halfway through my naturopathy course with Endeavour College of Natural Medicine. I was also doing, some other holistic health coaching. And then suddenly I found functional medicine in about 2010 and decided after my master's that I wanted to look for what was seeking me. So I always say that whatever is seeking whatever you're seeking is seeking you too. And that's how I believe I fell in love with functional medicine, because I already knew it was there. So I did the course. Cost me $1 trillion billion to do, and a lot of hard work over the years, having kids and raising kids and a husband that was on shift work and, just the demands of life. But I got through it. And Embrace was born. Embrace was born a couple of years back. It was launched, I think 2023 or 2024. Was meant to have launched prior to COVID, but we went into lockdown. And as you're aware, Victoria, or might be aware, here in Victoria, we had the longest lockdown globally. So that shut that down and shut everything down. I could only do what I was doing Zoom-wise with clients, but people weren't invested in their health back then. So people had stopped looking alternatively and holistically. And so that drove me batty, because I was even more determined and even more that other side. And that was that's probably another story. But that sort of made things more difficult. So I've worked through COVID, and then Embrace was born, and I'm here as a functional medicine practitioner. It's my business name and logo, and I've been in this space for Embrace since then. And but that's been a growing journey, Lindsay. Absolutely.
Yeah. Wow. Yeah. You've you've had quite the journey for sure. What are some of the biggest kind of differences or challenges that you've noticed from the conventional side? I've been on that side too, so I'm always interested to see what other people have to say that have as well. But yeah, from going from the conventional side to more of a root cause approach.
Oh yeah, absolutely. It's apples and pears, isn't it?
Mm-hmm.
I feel I got sick in between there. So I ended up with the unknown autoimmune issue. Because I was studying the nursing biomedical science at the time, I needed more information on it. So I felt like I was being dismissed. So I think that helped me move into the alternative side, because I started spanning out for my own sake to say, right, I'm not happy with the diagnosis you've finally given me after all being probed and tested and retested, and my extensive stay in hospital in my first year of university, that I was looking for other answers. And I knew I love science. I have a science hat, but I wanted to complement that, because I honor that. I wanted to complement that because I knew there was more. I thought, well, there's a big universe out there. There has to be more to it. We can't just say that's one side of the coin. We have a flip side too. And as I investigated that, and in my diagnosis about 10 years later with endometriosis, I come up with my own protocol, because I wasn't happy with conventional medicine's answer to everything. I wasn't happy with their answer to they thought I was diagnosed. They diagnosed me with bone cancer and leukemia first, and then it ended up being rheumatoid arthritis. Yeah, I was bedridden. I couldn't walk. I'd lost a lot of weight my first year uni. I was really, really unwell. And the rheumatologist had said to my mum, because she said, what's going on? And he said, send her straight to hospital. And he said, I wouldn't be calling the fire brigade if there's not a fire. So we really thought something was happening. So I was a curious person, always a curious child. So even in that time, as I was processing in hospital, I remember it was Daffodil Day, and they must have had me on so many cortisone, medication and so forth. So I was going through the hospital in a wheelchair, just passing through and visiting everyone and giving them daffodils, and still wondering what's happening to me. So I always was vested in that. And as I said, not happy with conventional medicine's answer. I was grateful for the nursing care, the hospital care. I was grateful for that. I understand that. Working with nurses, I've lectured them in the past. I've worked with them in their studies. So I appreciate them. But I didn't appreciate the diagnosis or what I was going home with. So me being who I am, I was really looking for more answers, and I did that. So I found my own protocols, and I fought my way through back to health and healing by saying, right, I'm going to look at this at in a holistic lens, or a functional medicine lens, which I probably wasn't aware of at the time. I said to my dad, go to the local library for me and get this book, because I was bedridden, I couldn't move, so they had to do everything for me.
Yeah.
So he'd come back with probably a dozen books at a time, and I'd be right, take them back, bring me this, and I was just looking at more and more, and that's where it come from, that thirst for more, in that, and that's where I studied naturopathy after that. So
Yeah.
I really needed to take a bite size in being becoming a practitioner of this sort of area.
Yeah, yeah, yeah. I mean, maybe that's why we clicked so well
Yeah.
too when we first met, because my story was somewhat similar. I never did the conventional route, but I ended up being diagnosed with like lupus, and then what we knew was celiac, and yeah, I never got to a point where it was organ damage of any kind. Like we caught it early enough, but I think I knew in my heart after after my role in traditional healthcare for all those years that I was like, they're not going to serve me. They're not going to. They're just going to slap a band-aid on it, probably tell me I have, you know, heartburn or something, and give me Pepsin, like,
Absolutely. Yeah. Yeah.
So yeah, yeah. And I think that resonates with the audience too, because a lot of women, PCOS, PMOS now, but
Yes.
whatever it might be, or whatever other diagnosis they might be dealing with, they're kind of just told to, this is how it's going to be, right? So how do you kind of, what do you see like with your clients, or even, in the day to day, as far as kind of bridging that gap,
Yeah.
and helping them understand that there's a, something deeper going on here, and not just treating the symptoms.
Absolutely. Lindsay, I call it women's wisdom, because I think we all have that intuition that there's something more, and I bridge the gap in the work I do. I'm here because of the silos I went through myself. I was sent from specialist to specialist area and given no actual conclusion or help, or what do I do next, sort of thing. So I say to women who come here mainly because they're exhausted and they've been to every specialist and they've been through every avenue and they've had every test done, and they've got orthorexia from foods because they don't know what to eat anymore. They're scared to eat.
Yeah,
They're scared to
I was there.
breathe.
Yeah.
Yeah, same. Scared to breathe, scared to eat, scared to go out, scared to do anything outside the norm because it's going to create a trigger or a flare. So I say to women, who come in, I'm glad you're here, because we can find out what's going on underneath all of that. And if you have a hunch that something is not right, then you should investigate that further. If your practitioner is not giving you the answers, if your specialist's not giving you the answers, you have every right to empower yourself and get the answers. And I think too often women are so scared because they'll say, oh, but I wanted to ask my GP this and this, but my general practitioner was sort of overpowering me and overriding what I was saying. And you don't need this test. It's not what you think it is. I don't think it's this. It's anxiety, it's depression. So they're being undermined. And, I had a lady that came in for PMOS now, as we say, as we call it, the new coined, thank God for PCOS. And she was told she was depressed and she needs to zip up her mouth and not eat anymore. And that was his answer to her. He called it the PCOS. She had a PCOS diagnosis, but that was the answer, and she was just having to live with that. Yeah, she
Well,
was in tears.
not to mention like the approach. If he literally, is that what the doctor said? Like, I mean, that's awful. That would like mess with you, on top of whatever else you have going on. You're trying
Absolutely.
to figure out what's going on, right? Like,
Yeah.
that's crazy.
So
Oh my gosh.
dismissive, the
Yeah.
dismissive approach, the the sort of, the way that the abrupt approach that she was led to feel leaving that doctor's office, that it was her fault she had this diagnosis because she ate too much or she was hungry or she, not looking at the other issues. So that again, that hierarchy with the medical profession, and not, we should be on par with our practitioners and feel
Exactly.
like
Yeah.
we're the CEOs of our own body. If we don't feel that we are empowered enough to speak up and say, no, well, I'm not happy with that, then something is wrong. We're allowing them to be in the driver's seat. And I think this is what's happening in medical system. It's been happening for such a long time with this over prescribing and the over medicalization.
Yeah.
But
Yeah.
it's, it's
And
really
it's
hard.
almost like to no fault of their own. I mean, that's how they're taught, right? But, I mean, and my next question was going to be, what do you think of the name change, from PCOS to PMOS?
Love it.
Because like to me, that is signaling that maybe they're
Yes.
starting to realize, that it is more than just, eat less, move more. I feel like a lot of people, a lot of women that I've talked to have been told. So yeah, what are your thoughts on that?
Absolutely. I love the name change. I'm on an advisory board with Monash University because I work with women with PMOS through the diabetes program. And I mean, this is our voice finally speaking volumes, because I was getting so sick and tired of seeing clients who had every single sign out there related to PMOS diagnosis, as you'd be aware, yet they were coming back from the conventional setting with, oh, look, they said it's not polycystic ovarian syndrome because I have no follicles in my ultrasound. It's, it's not diagnosed on my ultrasound. And I'll have to say to them, P-cell or PMOS is not always diagnosed with an ultrasound. There are other symptoms. And if there are enough of those symptoms and everything's happening for you, as we said, if it walks like a duck and looks like a duck, it is a duck, So it's one of those things where I feel holistically with that sort of, with that name, with PCOS branding or name, that wasn't fully encapsulating the holistic issues that PMOS brings with that. So when that name change came in a couple of weeks back now, a month ago, I think it was thanks to the Lancet journal, a lot of us were like, thank goodness, because I think a lot more women are going to come out of the conventional setting feeling heard and feeling like they're not going crazy,
Yeah,
because it's more than just follicles.
I mean, I recorded with her recently, but she was diagnosed with PCOS at a young age, and she was like, I didn't even really think about what it meant even at the time, but because it was so focused on ovaries, right? Just polycystic ovary syndrome or ovarian syndrome, and now obviously they realized. So she's like, even in my head, like I wasn't even thinking about anything outside of that. Like I was just focused on cysts on the ovaries, and now obviously we're starting to understand that there's the metabolic component and so many other things going on, right?
That's right. Metabolic, endocrine, that whole insulin resistance issue. The gut component. I mean, how many I've had come in to see me, young women who have that gut component that's not even looked at in the conventional setting, There's more to it. And I'm glad we're honoring all of that now. And I think it'll be picked up readily. It'll be picked up more so for more women, and so they can go off and do what they need to about getting treatment, sorting the correct treatment for it.
Exactly. I've been saying, because even when I, decided to kind of specialize in PCOS, when I was doing the research, it was like 12 to 20% or something of menstruating women was what I was finding that have it. And I mean, I've been on other podcasts even, and I've said, I think we're probably upwards of 30%, if not more. I mean, I think there's so many other cases out there that because they've just either they don't know it, they've been to the doctor and it's just getting missed, or misdiagnosed, missed altogether, whatever it might be. I think we're going to see a lot more cases of it
Yeah,
out there.
absolutely.
Yeah,
I agree.
yeah,
Totally.
yeah,
Yeah.
yeah. So you mentioned the gut health thing. So, you know, when people automatically, when we talk gut health, they may not understand that we're talking more about like the microbiome, right? Not just simple digestion issues. So how can the gut affect hormones? Whether it is PCOS, PMOS, or, you know, anything else, endometriosis, whatever that might be. What role does the gut play in that?
Absolutely. So, if we're not clearing hormones adequately through the gut, through the estrobolome, which are estrogen receptors in the gut, then we're not adequately utilizing hormones the best way we can. So we end up with an imbalance of hormones because, to explain that further, if we're not excreting xenoestrogens or recirculated estrogen adequately, then it can cause chaos, and that can cause a total imbalance to the gut microbiome, to the bacteria specifically, and then that increases lipopolysaccharides to move into the microbiome to further create ill health. That then, with the vagus nerve, will affect brain. That signaling will affect thyroid because of the axes between the gut and the rest of the organs. And we know that a, a gut that is a gut with dysbiosis or hyperpermeability, which is where we're having a disproportionate number of good bacteria and bad bacteria, are going to cause implications on thyroid health. So if thyroid health is off in that sense, then the signaling is off, and that can create further irregular cycles, that can create metabolic issues, that can create insulin resistance as well. So the gut is integral to the whole part and parcel of it. I'm fascinated in it, and I'm fascinated that we're only 10 years into our understanding of the gut microbiome when
Yeah.
Hippocrates said that it begins in that all disease manifests from the gut. So it's sort of exciting to see it, at the same time crucial not to miss. So I feel that in the sort of, when we're talking about PMOS, we can't dismiss the gut totally, because often the women that sit in my chair or in my couch over here, they all have some degree of gut issues, whether that is, poor gut bacteria, or whether that's leaky gut or malabsorption issues or small intestinal bacterial overgrowth, which has that potential to affect the risk of Hashimoto's disease. So until we sit there and we look at that, that some of these issues can be masked, that we don't know the correlation or the connection until we start doing all the mapping for it in our session. So it's important to really honour the role of the gut in looking at hormones, because it's a bit like taking I'll just say like HRT, like how many clients I'll come in, they'll say they're on hormone replacement therapy and suddenly they've got a whole host of other things going on. If they're not adequately excreting those hormones through the gut and then through bile into the liver, etc., into the third phase of detoxification, then they're going to have issues. They're going to have a buildup of these hormones. And it's a bit like, sort of our bin not being collected and then going out into the trash. It's that recirculating of estrogen and I think hormones that that should be disposed of. The other thing too, I find with women with PMOS will have a really poor stool as well. So their elimination's not great. So they might not always have an elimination. So they might not always be going to the toilet every day. And not realize until I speak to them that that's actually an issue as well. So important to look at excretion, assimilation, absorption. Gut has that role, obviously, with all of those.
Yeah, yeah. I mean, that was part of my journey. You know, I went to the functional health. You know, I went the functional health route, like I said, and yeah, I had no idea. Like, you don't learn that in nursing school, right? Like, about
No,
you
yeah,
know, about the gut. I didn't realize though that I guess it was that new still though. You said like 10 years that it's I guess really been
yeah, only
talked
10
about and
years.
studied. Huh?
Yeah.
Wow.
That
Yeah.
we understand the role of the microbiome in, our food choices, our mood, our everyday life, how we get up in the morning, how we get to bed at night, our energy levels. That's our gut is forever speaking to our brain. It actually speaks to our brain before our brain speaks. We think it's the opposite, but it's not.
Yeah.
Like I love that phrase, my gut microbiome made me do it. And I learned that in my functional medicine course. So, I think it was a woman in the US who had gone to court for, was going to be sentenced for murdering her husband. So wore a T-shirt apparently that said, "My microbiome made me do
Oh my
it."
gosh. I have not heard that.
Interesting.
Oh
And
my
if you look
gosh.
on Amazon, you will see T-shirts that my microbiome made me do
No.
it. Yeah. So you can
Oh my
blame your
gosh.
microbiome. I mean, when we look at our cycles, I mean, our gut microbiome is so entwined in our cycle. It knows exactly what's going on. Before I'll have women say just before they bleed, they may have burning in their gut. They may get nauseated. It speaks so much in terms of, it increases prostaglandins, so all the pain chemicals. It's just, yeah, it's quite, that women's intuition comes from that gut instinct,
Yeah.
and
Yeah.
that's the exciting bit.
Yeah. And so that brings up a good point too, because then if you're at it, like I know, at least here in the US, you know, birth control is the common go-to for women with, you know, PCOS or PMOS. So then I would imagine that's going to be affecting, right? If you're not, you know, affecting the gut and how, again, how you're processing hormones and the role that plays in everything. I mean, even after, probably after you get off of it, right?
Absolutely.
Yeah. Yeah.
Absolutely. We know, yeah, like antibiotic use in,
Yeah, of course.
you know, which is, I think I hear every second or third person right now because we're just hit winter here, is on a course. And we know that that wipes out colonies of good bacteria. You know, we know that we've got a barren desert in comparison to, maybe tribes in Africa, like in the Danzis, like who have really flourishing microbiome. Look, they're probably eating 80 to 100 different berries than what we have. And there's not, the agricultural movement is different there as well because we are subject to fertilizers and glyphosates, which wreck and ruin microbiome, unfortunately, and a lot of other pesticides and used readily on our fruits and veg and other foods and crops. I mean, look at gluten intolerance. I mean, you can't
That's,
find a
yeah.
PMOS client who doesn't have gluten intolerance. They go hand in hand.
Yeah. Yeah. Whether they know it or not, but yeah.
Absolutely,
Yeah.
yes.
Yeah, and
Yeah.
that's, you know, that's one thing too. I've said, you know, I was never diagnosed with it, but like looking back, I definitely feel like there were signs, you know, there were signs years that I had stuff going on that I
Yeah.
ignored. But even I feel like I might have had signs even of, you know, maybe like PCOS at the time. You know, I mean, I went like almost a year without a cycle. You know, like just things that now looking back, knowing what I know, and I'm like, oh my gosh, like I might have been headed that way. I might have had it at some point, you know, and then the autoimmune stuff obviously kicked in at some point.
Yeah,
So, yeah.
absolutely.
Yeah.
Yeah,
So
absolutely.
I do want to talk about adenomyosis because that one has, even our listeners might be here for PCOS, but I still feel like I get listeners beyond that. And even if it's just women's health, women's hormone, stuff. And it's a term that I've heard from a lot more women recently. So can you just maybe start by telling what exactly it is? Let's
Yeah.
start there. Yeah.
Adenomyosis is the sister to endometriosis, and it causes and creates a lot of pelvic pain and irritation. It is more intramuscular than endometriosis itself. Endometriosis moves a little bit around the pelvic cavity and can move into different organs all the way up to the nasal cavity and into the shoulder, whereas adenomyosis will pretty much be a condition where it is sort of more in the pelvic area, so more resides in the pelvic area more so. It can create infertility issues. It also has issues, has a very strong correlation with gut and irritable bowel syndrome. So it is something that women don't often get probably diagnosed properly for, and it can be often dismissed because it's not always in an ultrasound may be visible or easily picked up. When I'm working with clients, I'll treat it in the same way that I will treat endometriosis as well. And I will look particularly at a lot of pelvic work and fascial release for it. But adenomyosis is very much tied in with the nervous system regulation and requires a bit of that rewiring to help with the pain, to help with the bladder issues, and to help with the bowel. There still can be adhesions between the bowel and the bladder can still be found with adenomyosis or adenomyosis. And also in the pouch of Douglas, which is in the perineum, which is just in between, which can be quite painful as well. Women can also develop cysts as well. And it can actually exacerbate period pain, inflammation, heavy periods, irregular bowel movements, so constipation. It's quite more probably functional, not functional, but is in functional than endometriosis is in a way. So I think really honouring pelvic floor work and honouring, a pelvic physio to work with side by side, to help with symptoms. But there is that correlation with the gut, and there is the correlation with obviously nervous system, but a higher level. We know that the level of depression with women with endometriosis is high, but what we're understanding a little bit more with adenomyosis is it's a little bit more specific to its condition as well. And that's something that I think, where women are offered a lot, antidepressants and so forth to help with the pain, and also, the neurological issues, and also, just with the pelvic pain and inflammation, really, because that can help. SSRIs can help with that, and the gut as well.
Yeah. Wow. So, I mean, I feel like a lot of the times, at least for endometriosis, women are told to have a hysterectomy kind of as the ultimate, I guess, treatment you want to say. So
Yeah.
a hysterectomy with adenomyosis wouldn't necessarily take care of things.
Not particularly. Yeah, look, I feel most of the time, hysterectomies are, I mean, well, in the US, we know that they're surgeries that are the most
Yeah.
unnecessary,
Yeah.
and cesareans apparently. But having said that, with hysterectomy, I think hysterectomy is often the answer to a lot of fibroids and adenomyosis and anything related to any issues with the uterus, and it isn't the answer. I think we need to look deeper at antioxidants. We need to look at the way our, using supplements like, NAC, for example, include increasing the glutathione levels. Just ways that we can increase gut motility to not overly, but just to a certain point where we're making better stools, that the Bristol stool is showing it's a 4 and a 5. It's not a loose stool and it's not difficult stool to pass, because that's what a lot of women with adenomyosis will say, It's quite debilitating pain because of that intramuscular, the pathophysiology of it. So, I think removing a partial hysterectomy or full hysterectomy is going to, depending on the age of the woman, is going to open up another can of worms for her, because she's going to suddenly, if she's young, go into a fully blown menopause without being ready for that, and then risking, the heart disease, dementia, and bone density issues later on in life. She's 37 and she's been told she needs to have a hysterectomy because we can't manage the adenomyosis. So I think, unless it's cancer, unless we're looking at a non-benign state, I would leave hysterectomy as the very last option. And I think a lot of the times it is quite unnecessary. And if I can tell somebody, hey, have a think about this hysterectomy because I know you're in pain and I know it's affecting your quality of life. See, people start to judge the quality of life and think, well, this is not living. I can't do this anymore. So if I remove everything, it's just going to fix it all. And that's our womb space. That's quite a sacred area. After hysterectomy, there's a whole new chapter, that affects the nervous system. We're quite in tune with all of our pelvic area. So if we're ripping out organs, essentially, we're also taking away that sacral place. We're taking away that that core that we're so in tune with, no matter what stage of the lifespan we're in. And your nervous system is not ready for that. Or if you're not ready for that emotionally, rehabilitation after that is a long stretch. And look, I've had clients who have had a full hysterectomy, and whether that's phantom pain or whatever it is, they're still suffering, because I think that whole connection that was severed hasn't fully been restored, if that makes sense.
Yeah, that's kind of why I asked that question, because I was like, from what you're telling me, there's a lot more to it.
Yeah, there is. Absolutely.
Yeah. I mean, inflammation, of course, and the nervous system. I mean, it comes up in, like, I say this all the time. It's like in just about every episode I record, I feel like we talk
It is now.
at some point about the nervous system, right?
It's a buzzword.
It does.
Yeah.
But it plays a role.
Absolutely. Yeah.
I mean, in so many things, and that's kind of at the root a lot of times. Yes, we talk about inflammation being at the root too, but if the nervous system is fired up all the time, that is contributing to inflammation, right?
Absolutely. Nervous system stores a lot of memory. It's backed up with your journey. It's backed up with your pain and your suffering and your experiences. It's sort of there as a data set. You know, it's humming in the background when you're asleep. It's always humming in the background. It just wants safety and wants to be reminded that it's safe. Any pain, any inflammation, any imbalance, any ill health will set the nervous system off. And that's going to be on idle, and that's not going to be or feel safe or happy until whatever is going on is fixed, repaired, healed, until we reach an equilibrium. You know what I mean? So, like, I know with you probably feel that too, past ill health. I mean, my journey with whatever autoimmune issue I was diagnosed with at the end when I was 19, and we're going back 30 odd years ago more. You know what I mean? So still comes back every now and then to remind me it's there, whether that's if I'm not feeling safe, if I'm not feeling secure, if I'm suffering pain, if I've got period pain, if I'm suffering some sort of perimenopausal symptom. It'll remind me of that. If I feel anxious, that's that reminder. Our nervous system is very primitive in that way. And yeah, everyone's throwing it around in their podcasts as well as their, you know, you might get your algorithms on your social media. It's coming up all the time. Trauma work, nervous system dysregulation work, rewiring. But look at perimenopause. It's neuroplasticity. I mean, what's that? That's rewiring of the brain. I mean, what is that? That's the autonomic nervous system. And that's all part and parcel of what nervous system is about. In that transition, your nervous system gets the biggest shake-up it's ever going to get. You know, puberty is one, but that's a transition that gets really a reboot. You know, it's that declining estrogen is going to cause your nervous system to go into, oh my God, what's happening? We need to hold on to this estrogen. Let's go into panic mode. Let's press all the panic buttons and send you off into an anxious state because we're ringing the alarm bells. You know, and that's what the nervous system does. You know, so I learned to work on that through my journey a long time before social media was even a thing. You know, so it got me through.
That was a big thing for me too, because my tipping point was COVID. And so I think all the years of stressors and go and all of it, and then that final big stressor, you know, was like the tipping point when everything like kind of came to a head. You know, and you're mentioning about, you know, with your journey. I mean, I feel like once you kind of tune into that, once you are just aware of your nervous system, you know, the role that it's playing and the role stress and traumas are playing, you're so much more in tune with your body and with, you know, so like for me, sometimes if I'm a little bloated, you know, on a day, I'm like, did I eat something? Did I, you know, what was my stress like, right?
Yeah,
you know,
exactly.
Not necessarily to an obsessive point, but I just go into that mode of, you know, what's going on because I'm so much more in tune with it than I ever was before.
I think that's what happens when you have been on a journey of ill health. I think you become more intuitive to everything. And I'm the same, you know, if I'm bloated or if I'm feeling like a little bit, my energy is off or something, I'm like, okay, what did I eat? What happened yesterday? Did I do this? Did I start taking a check and reevaluating what's been happening? And I think my nervous system reminds me to do that as well. You know, you're just so in tune with our bodies and how they work that we almost feel like they should be working as clockwork, but they don't always. And that's normal too, you know?
Yeah. You mentioned even with the glyphosate thing, I wanted to go back to that for a second. I thought about that because like I think looking back for me, that was a big thing too, right? I know.
I hate it, Lindsay.
You know? But it's even, you know, beyond that. I mean, we're seeing like all the microplastics, you know, and all these other
forever
environmental,
chemicals.
environmental things that, yes, sure, there's at some point we can't control everything, but there is, some stuff that we can control. Is there any advice for somebody like tackling whether it's food or,
Yeah,
forever chemicals in cleaning products, beauty products, whatever it might be, like where do you
absolutely.
kind of start with that? What would you recommend?
Yeah, because you raising the point of microplastics, especially those PFAS chemicals, those forever
Mm-hmm.
chemicals that are already in our system, that are very tenacious in the way that they like to stay in our environment, our biological environment. I I'm all about reducing the chemical burden because I hate how we are over fertilizing, and I hate seeing it in the street. I hate seeing them spraying. It triggers me because I've learned so much about it and how it destroys the gut microbiome and wreaks havoc on our hormonal health. So, what I do say to people is make sure you are looking at what you're putting into your body food wise as much as you can. It is expensive to eat organic, I understand that, but try to minimize processed foods as much as possible and chemicals. Try to be mindful of what you're using on your body. Your hair care, your any moisturizers on that you put on your body, your makeup, perfume. I feel I've got teenagers, and I think this generation love their perfume. Or maybe I didn't realize before, but I'm really sensitive to it. So I
Mm-hmm.
find, I'll have a group of, 17 and 18-year-old kids, and they'll come here before they go to a party, and I can just smell the perfume and cologne, and I think, oh my goodness me. Perfumes probably are one of the biggest endocrine disrupting chemicals out there. Kids walk out of the house with about 150,000 different chemicals in their bodies before they go to school and before they go socializing. I mean,
Oh my gosh.
girls are transitioning to puberty at age 7.
Yeah.
So look, we got to look at all of these things. I mean, we have Sephora and Mecca Maxima, which are two big cosmetic shops or industries, and they have a lot of products that are full of chemicals. So really minimize your makeups, minimize what you're using, what you're putting into your body, on your body, your drinking water, all of those things. Yeah, they're really important. I think the less burden we have on our body, the more your liver is going to love you, and it's very resilient. The liver loves you. If you love it back, it can be fixed, it can be healed, if we look after it. So just be really mindful of that. Yeah.
Yeah. Yeah. Yeah. Um, so as we kind of start wrapping
Yeah,
up
yeah.
already,
Yes, absolutely.
um, what's one thing that you wish every woman with PCOS or, PCOS, PMOS,
Yeah.
or maybe even just, any other struggle with their hormonal health, what do you want to tell them? What do you wish they knew, you know, before starting their healing journey?
What I wish they knew, definitely not to be not to be gaslit by their practitioner. I think to feel that they don't have to accept the diagnosis always. And I feel that I would say to them, if you feel that you need another opinion, seek a second opinion or a third opinion. You are the CEO of your own body. You have the right to look further, look deeper. Don't trust. Conventional medicine is great, but also look into functional, alternative space, holistic space, for other answers, because we're not in parts and pieces, we're in as a whole. So looking at symptoms only sometimes doesn't work. There's no Band-Aid effect. That's not working, because things are going to rear their ugly head again. We need to look deep, and I would advise not taking no for an answer. And because I was a person that didn't, and I fought my way through that, and I was sort of, if you told me something, I'd second guess it and think, nah, I think I know better, but that's just me. Not everyone's the same. Is trust your intuition, trust your gut. It'll tell you a lot, and listen to it. Really listen.
Yeah.
My kids laugh at that because I mention that. Listen to what's going on. In some other recordings I've done, they've used it as a meme now. They've done a funny thing for me. And I was like, just listen. They go, just listen, Mum. Yeah, I was like, yeah, you listen to your body. Listen what's happening. Listen in.
Yes. No, it's so true, right? I mean, that's my big message with like everything I do is, listen to your body.
Yes.
No shame, no judgment, right? Just listen, be curious, and start understanding what your body's trying to tell you, instead of, like punishing it or trying to suppress, whatever is going on.
Yeah, like sometimes there's big red flags everywhere. You just, but some people will come, but this symptom keeps coming up. Well, listen to what's happening, there's something behind that.
Yeah. Is there any like daily practice that you recommend to your clients, or maybe you do, that you believe creates the most long-term impact?
In my 30s and into some of my 40s, I was go, 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 Lindsay. I now take time out, when I can, when it's not a busy morning. I take time out and have at least 2 mornings a week where I'm not go, go, go. And I'm present with a cup of tea. I'm present with my herbs. I'm present with my garden. I get out and I look at the orange tree right now, because the orange tree is flourishing. Or it might be the lemon tree in the warmer months, I'm present with the environment, and I take a beach walk. So that for me resets. In the summer, I swim in the ocean, so that'll be my reset. In winter, I'm not as brave. I wish I was. Might get a wetsuit. But I think that evolutionary mismatch between us and the environment, we need to meet that again. So I try 2 times a week to be present and meet the environment some way,
Yeah. I love that. I mean, yeah, like that was actually my morning, because I work out most mornings, but I like my mornings of just getting up slowly, and
yeah,
and even sometimes I, dive into a little work, but it's just still like I'm like,
yes,
just at my own pace. I'm not rushed to do anything, right? And even for the woman that's listening that might have a busy schedule and a busy career and or family, whatever else it might be. I mean, there's still those moments, right, that you can take, throughout the day. It may not be an entire morning, but it might be, a few minutes here and there. I feel like where you can still make the best of it. Yeah.
Absolutely. So important to start your day for, your own stress levels and your own, well-being. Definitely.
Yeah. But I love the getting outside component that you mentioned.
Yeah,
that's a super important part of that.
When with my protocols, often it'll be get outside in the morning for the first 10 minutes. And have your cup of tea or whatever out there. Yeah, just before you get on your socials or you start answering emails and messages, and which I probably do too many times of the week, but at least 1 to 2 times a week. Just hearing the birds in the morning, or, watching the dog get up lazily and being present instead of rushing.
Yeah. Just being present. Yeah. Love it.
Yeah.
Well, it was so great talking to you.
Same.
One last question is, how can people find you and connect with you? I'll link everything in the show notes as well, but yeah, what's the best way to find you?
Yeah, absolutely. So on Instagram at embrace_functional_medicine. I'm on Facebook, Sharon Casagalia. My website is embraceholistichealth.com.au. I'm on LinkedIn, Sharon Casagalia. Look, I'm kind of everywhere at the moment, on all those platforms, on YouTube,
Good.
as the Embrace Functional Medicine practitioner. So there's a few of my reels and a few, some presentations I've given here and there on gut and perimenopause, etc. So yeah, I'm around. So
Awesome.
yeah. Follow me on Instagram. Yeah,
Yeah.
I'd love to
Awesome.
see you there.
Well, thank you so much. Again, this was a great conversation. I feel like we could probably just keep going.
Yeah.
But I'm about to turn into a pumpkin. So,
Yes. No, thanks so much, Lindsay. I know
so
it's late for you
yes,
as well.
but yes, I really appreciate you being here. Thank you.
I appreciate being on, you having me on and offering the opportunity as well. Thanks, Lindsay.
Recording stopped.
Yay!
That was good.
That was awesome.
That was
Yes,
really
good
good.
stuff.
Thank you.
Yes. Yeah, love it.
Thanks.
I know. It's like great. I mean, like I said, the nervous system piece just comes up so much. Whether it's like a dedicated episode, I've done some of those now on nervous system stuff, or it still comes up at some
Oh,
point. Either way, I
definitely.
feel like. So
Yeah.
it's like, for the regular listeners, I'm like, I hope you're like starting to
See
really
that there's
understand
a
this. Yeah.
trend. Yeah. Because people don't understand it. When I talk about it in my videos or whatever, people see me in the street, they'll say, "What were you talking about? The nervous system? Like, what's that?" I almost have to get out a dictionary. And I'm like, "Oh, yeah, I know. It's just, it is. It's an untapped area, but it's one that we just have to really, I feel like I have to constantly be up in the research of it, and I've got
Yeah.
tons of books and tons of, the holistic psychologist and nervous system gurus out there, just to keep reading, because often, someone else asked me in a podcast, say, well, if you don't do, work with the herbs or supplements or lifestyle intervention or nutrition, what do you do? And I say, I do nervous system regulation. So I actually have my own sort of sessions on that specifically,
Nice.
because it's a
Yeah.
piece
Yeah.
to where we start with. If that's not, I
Yeah.
feel if that's not sort of safe, feeling safe, you can't move on with
Yeah.
healing.
Yeah. Yeah. Nothing else is really gonna like work or have the impact, that it normally would, for sure.
And people
Yeah.
don't understand that.
No. I don't remember if I shared. I went on a like wellness retreat back in April. I guess it was, oh my gosh, almost 2 months ago now.
Yeah, it's gone quick.
Um, but yeah, it was in Costa Rica.
Yes.
And I mean, that was like a big thing for me. I mean, it was like therapy, that I didn't know I needed, but it was, yes, big nervous system reset too.
Oh,
I
I
learned so
love it.
much. I'm actually going to be starting a breathwork facilitator training in July as well.
Oh,
So I can start incorporating that more into what I do with my clients
fabulous,
as well.
Lindsay. Yes,
Yeah.
love that.
Yeah.
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 I love breath work and sound healing and
Yeah.
I don't know
I've
if
been
I
doing a lot
told you
more of it.
I don't know if I told you I was doing this sound healing. And
No, I don't remember.
anyway, at the end when he played something and I saw a deer in the forest. Yeah.
Okay.
Really like a deer. I could see its lashes and everything. And
No
it
way.
was basically just in the forest, like waiting for the next thing to happen. I don't know if it was in some sort of danger, if it was just waiting for something to pass by. And then I just broke down in tears.
Oh my gosh.
It was
And this was
such
just
a
this was
moving.
from a sound healing.
Yeah.
Wow. Yeah. So when I was in Costa Rica, we did it two different nights, but I don't remember what the name of the breathing, but you breathe in through your mouth and out through your mouth.
Yeah.
And you kind of do it rapid. It's almost like you're hyperventilating,
Yes.
basically, so
Yes.
flooding the body with oxygen, right?
Yeah.
And you have kind of
throat.
these, you can have these revelations, these releases. Yeah.
Yeah.
And so the first night I did it, I had some really good stuff that came to me. And then the second time we did it, I started crying and I couldn't stop.
Yeah.
I'm like, she came over, the host, she came over and was like, holding my hand, and I'm like, I can't stop, and I don't even know why. It's just like, she's like, just let it go, let it out,
Yeah, let
and
it
that's
out.
where, yeah, we talked a lot about like the generational trauma piece, too, that it might even be beyond,
That's
beyond us,
another
obviously.
area.
So yeah, that's another thing. But yeah, so,
Absolutely. That's it's amazing. It's
oh,
such a beautiful experience. Like it
mm-hmm.
needed to happen. And I know crying
Yeah,
after that, I like the guy who was doing the sound healing with us, he approached me. He's like, "Are you okay? Like, do you want to talk about
yeah.
it?" And I was just like, "Oh."
Yeah.
But I just felt so. And afterwards, I went for a walk down the village area there and had some lunch. And I just remember feeling so exhausted.
Yes, exactly. Yeah.
Yeah, I was just like, oh my
Yeah.
gosh, just someone has just, I don't know, given me like a rigorous massage or something and deep tissue massage, or I've just come out from been swimming all day at the beach, that feeling you get.
Yeah.
Like, I love that feeling. I've been swimming all day at the beach and I come home and I could feel the waves. I just felt like I was moved by the experience and it was just
Oh, yeah.
so beautiful. Yeah.
Yeah. Oh my gosh.
Yeah. Thanks so much,
Awesome.
Lindsay.
Yes, thank you. I will keep you updated on when this goes out and everything, of
Okay.
course. And yeah,
Yeah,
again, it
looking
was it
forward
was
to it.
great. Thank you so much, and
Thank you so much.
we'll be in touch.
Yeah, absolutely. Enjoy your summer.
Thank you. Yeah, enjoy your winter.
Winter, never.
Awesome.
Thanks,
Okay, well,
Lindsay.
have a good rest of your day.
You too. Thank you. Bye.
Bye.